Hi guys, my name is Dr. Anjana and I'm currently expanding my career in cosmetic and aesthetic medicine. If you're new here, hi, and if you're here again, then welcome back to my channel. And in today's video, I'm going to be doing a little get ready with me while I do my makeup. I'm going to be talking about retinoids, everything about retinoids, how to use it, when to use it, the side effects of it, when to stop, when to switch to a stronger one. By the end of the video, I will also do a tiny Q&A session. These are questions that were asked to me by my followers on Instagram. If at any point in this video you find my content useful for you, please subscribe to my channel. Without any further ado, let's get into it. So what's a retinoid? Retinoid is an umbrella term used for vitamin A derivatives. It has 4 different generations, right? So the first generation is retinol with OL, retinal, AL, also known as retinaldehyde. And then we have retinoic acid, commonly known as tretinoin. And then we have isotretinoin and L-tretinoin as pills. So the issue here is people on Instagram really call me out whenever I talk about retinol, right? They think retinol is prescription and I shouldn't talk about it. Well, no, sister. Retinol is over the counter. Now, second generation is something that we do not use in skincare because it is really unstable. The third generation is adapalene and tazarotene. Fourth generation is still under research and I don't know when is it gonna come into power, but yeah. So the commonly asked question is, when should I start retinoid in my skincare? When should I incorporate it? Well, depends on you. As per the FDA, you're allowed to use retinoids in your skincare or as a medication since 12 years old, right? But it depends. Are you someone who's dealing with acne as a teen? Yes? Then use retinoid when you're in your teenage years. For example, I was somebody who did not deal with teenage acne a lot. So I did not actually use retinoid in my skincare up until I was 17, 18 years old. If you're trying to start it as an anti-aging, then you can start it from like 20 years old, 22, 23, 24, 25. There's no such age. Like, you know, some people tell that, oh my God, I'm too old for retinoid or I'm too young for retinoid. There's no such thing as young or old. If you feel like starting, just start. And if you're a teenager, then you might want to get a help of a medical practitioner. The second most common question that I get is, which retinoid should I use? Now the question is, have you ever used retinoid in your skincare ever? If the answer is no, then another question pops up. Are you willing to go to a dermatologist and start your retinoid journey, or do you want to start it over the counter? If you do not want to go to a derm, then retinol is your answer. If you want to go to a derm and consult them, then they will prescribe whatever is best for you. In my opinion, retinol is the right place to start. Another most common question that I get is retinoid safe? Is retinol safe? I'm a teenager. Is XYZ safe? I'm only 20 years old. Will retinol be safe for me? I'm 24. I started using retinoid when I was 17. It's very safe, trust me. Until and unless, like, you know, you have another skin condition that you want to address, you will definitely have to get in touch with your dermatologist and work it out. For example, hormonal acne, right? At the end of the day, you need to treat the underlying cause here, which is the hormones. So using retinol independently without the help of a doctor might not help. This foundation is by Lakme, and I don't know, I'm really bad at choosing foundations, so I'm just gonna add the Maybelline skin tint. Maybelline skin tint is a little light for me. Lakme is a little yellow for me, so I'm just gonna mix both. Another commonly asked question is it breastfeeding and pregnancy safe? It is not pregnancy safe. If you use it during pregnancy, you're only putting yourself and your child in danger. So don't use retinoids during pregnancy. Now about breastfeeding, right? It is a controversial one. I do not suggest my clients or patients to use retinoids during breastfeeding, but with the help of a dermatologist or an aesthetic physician, it is actually safe, or it can be safe. But if you're skeptical to use retinoids during breastfeeding, and since it's contraindicated during pregnancy, you can use azelaic acid. That is the best alternative for retinoid by far. Not bakuchiol, not salicylic acid, not other acids, blah blah blah. azelaic acid is the one. I feel like bakuchiol cannot take the place of a retinoid, to be honest. But if you want to use it during pregnancy, it is safe. Bakuchiol is safe, azelaic acid is safe, but as an alternative to retinoid, azelaic acid is by far the best ingredient. So the next question is, what if I purge? Now I feel like this is the thing that actually stops people from using retinoid and including retinoid in their skincare, to be honest. But I feel like purging is something that might happen or might not happen depending on your skin type, the frequency that you're using, and how you're using, and if you're getting help from someone or you're using it independently. And I also make sure that my clients purge minimally. But how do I do it? Sandwich method, using it slowly and steadily and building up the pace, proper protection of your skin while you're applying it. These are the steps that I really incorporate into my client's routine, my routine, etc. Purging, if it happens, usually lasts anywhere from 3 weeks to 8 weeks, and it is normal to purge. You're not gonna purge on areas where you normally do not get pimples. For example, if you're getting pimples on your chin, on your cheeks, and on your forehead, you're gonna purge on the same spot. Next question is how to start with retinoids. Again, if you're someone who is starting with nothing, then use retinol. 0.1% to 0.3% is the best percentage to start with, because that will cause minimal purging and also give you optimal results. But if you're somebody who has an underlying condition, definitely visit a derm. And how to start? Start it once a week for 4 weeks and then increase it to twice a week for the next 4 to 8 weeks ideally. At night, use it after double cleansing. When your face is bone dry, apply it. Avoid your eyes, avoid your mouth areas, and apply it. Let it sit for 10 to 15 minutes. Follow it up with a moisturizer. If you want to use a sandwich method, then double cleanse, moisturizer, let it sit for a bit until your face is dry. Use retinol, then use moisturizer. That's the way how you do a sandwich method. So when can you see the results, right? You can see the results for acne anywhere from 8 to 12 weeks. For hyperpigmentation, anywhere from 3 months to 6 months or more, depending on the type of hyperpigmentation you have. Melasma generally takes longer. And for anti-aging benefits, anywhere from 6 months to a year. Retinol takes time. You need to be consistent, and most of the people usually stop after a week or so because they start to purge. They think that, oh, the product is not working for me. But listen, sister, brother, whoever, it is working. It is working. You just have to push through the purging, through the dryness, through everything. You just have to push through. Someone asked me, do I have to use acids when I'm using retinoids? Yes, retinoids increases the skin cell turnover, thereby increasing the collagen production in your skin. But when there is a speed in turnover of your cells, the dead skin cells usually come up faster, which is why you need to include acids like lactic acid, mandelic acid if you're new to acids, and glycolic acid if you're, I don't know, a pro, or salicylic acid if you have oily skin. This will exfoliate the top layer of your skin. You need to include acids, retinoids, your skincare in a week, but make sure they are separated properly. Otherwise, you're only gonna cause irritation. Do not use any other kinds of actives on the day when you're using retinoids. Most of the times what people do is they have AHA, BHA derived face wash, then use a vitamin C derived moisturizer, then use a retinol. No, that is not how it works. Try to keep other products gentle as possible without any actives, then use a retinoid. So before I move into the Q&A section, right, I want to talk about this last point, which is the side effects. Side effects are dryness, irritation, flakiness, redness, and then damaged skin barrier, broken blood vessels. So make sure that you're pacing out your retinoids and including it in your skincare really slowly. And if you're unsure, get the help of a medical practitioner, aesthetic physician, medical cosmetologist, dermatologist. Do not listen to skinfluencers because what they portray as skincare is actually not skincare. It is a medication. Tretinoin, isotretinoin, All of these prescription grade medications are medications and not skincare. If you mess it up, if you get it over the counter, because I know in India it is really common to get all of these medications over the counter. So if you're getting it over the counter by word of mouth, by listening to a skinfluencer, or by listening to your friend, you're only walking a path towards damaged skin barrier. Using Tretinoin, isotretinoin, and all of these prescription grade medications, right? The side effect is not limited to just dryness, flakiness, and all that. It's much more. Broken blood vessels cannot be fixed. You will need a cosmetic treatment. It might also give you internal issues, which I do not want to talk about right now. But just know, do not follow skinfluencers, friends, or whoever you want to follow and get Tretinoin, isotretinoin over the counter or any other medication which is portrayed as skincare on the internet over the counter, because it can be harmful and situations like these are irreversible. Follow your doctor all the time. Having a medical practitioner who knows about skin in and out and can help you is really important. So moving on to the Q&A, I have my iPad over here and let's check each one out while I do my makeup. So first question, adapalene also has anti-aging benefits like Tretinoid? Well, not really, because adapalene is rather a medication for acne. Next question, I am using Tretinoin for 4 months, have no effect. Well, it depends for what you're using. If you're using for acne, then you might want to go and check with your dermatologist and see why is it not working, and ask them for a different generation of retinoid, maybe oral, maybe topical, or the same one but from a different brand. If you're using it for hyperpigmentation, anti-aging, definitely 4 months is not enough. You need a longer period of time, probably 8 months, more, depends. Recommendations for retinol having greater strength of 0.6. If you're looking for something that is 0.6 and higher, then you might want to shift to retinol now. What happens when you stop using them? Do you have to use it forever for its benefits? Ideally, yes, but I feel like it's totally on you. If you want to use it, use it. If you don't want to use it, no, don't use it. Is using adapalene over moisturizer effective? Do you have acne? That's the question. Why are you using it for? Effectiveness, yes. Adapalene is effective for acne. Over moisturizer, I'm assuming it's a sandwich method. Then yes, it is effective, provided you're using it at night and following it up with your SPF and stuff like that. But if you're using it for anti-aging benefits, anti-pigmentation, and scarring, then no. And if you're using it over the counter for any percentage above 0.1, then I'm coming to get you. Next question. How to bring out retinoid back in routine after a break because of skin barrier damage? Well, I would suggest doing sandwich method. Use it 2 times in 10 days. Once in 10 days, 2 times. And after using it 2 times, then use it once every week, sandwich method. So do you understand? Like, in 10 days, use it once. Then again in 10 days, use it once. Then each week, use it once and once, but with a sandwich method. I hope that helps. Next question. But let me apply my lip gloss first. I don't want to make my lips dry, because last time I made it dry, I got a chemical burn after using a weird ass lip balm. So yeah. Side note, I was filming the video. Actually, I forgot to click the record button and I already had done a full face beat. So moving on to the other question, what are the different kinds of retinoids and who should use which one? Again, like I said, there are 4 generations, right? First one was retinol, retinal, retinoic acid, also known as Tretinoin. Then we have isotretinoin and allitretinoin, 2nd generation, throw it out. 3rd generation, adapalene, tazarotene. 4th generation, still in research. Now, who should use which one really depends on your need. If you're starting out, retinol for sure. If you're looking for acne control, then adapalene 0.1% if you're looking for over the counter. And if you're somebody who has uncontrollable acne or has underlying issue, definitely go see a dermatologist and get it prescribed to you. Should we apply on dry or damp skin? And after or before toner? After toner, dry skin. How many times a week to apply retinol? Again, When you're starting out retinol, definitely use it once a week for like 3 to 4 weeks and then increase it slowly. Adapalene or over-the-counter retinols? This is the next question, okay? Adapalene itself is over-the-counter for 0.1% and over-the-counter retinol, over-the-counter, fine. But again, it depends. Adapalene will treat your acne, right? Over-the-counter retinol is more like all-in-one kind of thing. So yeah, depends on what you need. My friend asks, does it also help with whiteheads and skin texture? Yes, it does. At what age should one start using it? Again, there's no such thing as too early, too late, whatever. I mean, too early would be 8-year-old. And if you're 8-year-old and watching this video, like, what the hell are you doing? Maybe preparing early, but yeah, whatever. There's no such thing as too old, too early, blah, blah, blah. It totally depends on what are you looking for. Acne, teen acne, anti-aging. Start whenever you are comfortable. My mom started in her 30s, so it's totally fine. Next question, retinoid suggestion for 60+ women. It is always suggested that if you're starting out with any form of retinoid, you might want to start slowly. So you asked me retinoid suggestion. I cannot suggest you prescription grade, so I would definitely say retinol is something that you should look in for. Next question, if I can't visit a dermatologist due to some reason, then how can we switch to Tret? You cannot switch to Tret because it is prescription grade. Don't want to damage your skin, right? Retinol for very sensitive skin. For very sensitive skin, you might want to use a cream-based retinol. Like for example, Olay, for example, Pilgrim has retinol infused moisturizer. Those are the things that you might want to look into. Start with that and work your way up. And again with retinol, even if it's cream, start it off slowly. What kind of cleanser and moisturizer to use with retinol for oily acne-prone skin? Cleanser, do not break your bank. Literally, I'm telling you, do not break your bank ever on cleansers, okay? Just take it slow with any cleanser of your choice. And yeah, maybe moisturizer is something that you might want to look into. And then retinol, yeah. Use your retinol with any cleanser of your choice. To be honest, I feel like even when you use like Clean and Clear, that is also fine as long as you're putting something on your skin to bring back the pH into your skin, So do not break your bank on cleansers, really. Next question, I've got super sensitive skin, but it's also oily at the same time. What retinoid should I use as a complete beginner? You should use a retinol. Use a 0.1 to 0.3% if you think your skin is sensitive. There are options like Minimalist. There are options like Dermaco. If you're looking for international brands, then probably you can DM me on Instagram and I will help you out. So yeah, breastfeeding mother alternate. Azelaic acid, all the way. Start with azelaic acid 10%. Just talk to your doctor about it. They can prescribe you a suitable azelaic acid for your skin type. Next question, at what age should we start retinol? Again, no such thing as too early to start, too late to start. You can start as a teen if you have issues. You can start in your 20s. You start in your 30s, 40s, 50s, 60s, whenever you feel like, whenever you feel you're ready. Can you suggest a good retinol-based eye cream? I do not know a retinol-based eye cream. Wait, I do know. Bioderma has one. This Cipla, right? Rivella company has one. And Beauty of Joseon. It's not retinol, it's retinol, but it's amazing. I've been using that. Do I have to consult a doctor before starting retinoid? Ideally, yes. If it's a prescription grade, yes. If it's not retinol, then start off slow, build it up slowly. Next question. Adult acne. Is there something else that can be done? Tretinoin has been prescribed 2 different doctors. Okay. And then she says, my sister has been using topical Tretinoin 0.25%, probably, but there's no improvement in acne, dry skin. If it's acne, switch to adapalene and probably see a different dermatologist. And there are medications that can help with acne like isotretinoin and stuff. So probably go see a doctor who is willing to heal you, who is willing to have a follow-up. And always talk to your doctor, like, you know, okay, this is the issue that I'm having. Like, okay, the doctor gives you a medication, ask them, like, you know, how the medication will work, what to expect, when to expect, and also ask them, like, you know, if you can have a follow-up of your skin condition. So yeah, next question. What time to shift from retinoids to retinol? She said retinoids to tretinoids, but I'm just gonna say retinol to tretinoin. It's a really long story. I personally started retinol when I was like 17, 18, 19. I used it 17, 18, 19, 20, even 21 probably, and that's when I switched to Tretinoin, and I'm 24 now. So it's a really long way that you're paving for yourself. You start with 0.1%, 0.3, then you move on. Moisturizers to use a lightweight moisturizer, because she said that she has a combination skin. Probably Simple has really good moisturizers. Do we need to use a face wash in the morning if you use retinoids at night? Your wish. I mean, retinoids have already worked at night. It's already inactive, so you can use it whenever. Does it help with hormonal acne? Yes, it does, provided you treat the issue with your hormones with the help of your doctor. Hydrating tips while applying it for very sensitive, oily, acne-prone skin. Glycerin all the time. Glycerin. Mix it with water. Apply it on the days when you're not using a retinoid. It helps a lot. So that was the last question. And yeah, if at any point of given time you found my video helpful, please subscribe. It really helps me grow and stay encouraged, or remain encouraged, or encourage me to make more videos like these. Apart from that, the makeup didn't turn out so good as I expected. Like, I added glitter eyes, and I do not wear falsies because I'm super allergic to, I don't know, my eyes are really sensitive. So yeah, apart from that, what else? Before I end this video, I really want to remind you, do not follow skinfluencers who do not have a medical degree, of course. Because, like, you know, somewhere down the line they're gonna use Tretinoin, and they're gonna tell you that, oh my god, I got XYZ results by using Tretinoin, by using other medications like hydroquinone and stuff, and you will be, like, you know, tempted to buy it, and most of you will buy it. Why? Because they are showing the results, and you think that you will get the results like them, but that is not it. They might probably be hiding the fact that they have a dermatologist at the back having their hand over their heads. I don't know, like, you know, they're probably careful enough, or just sheer luck. Don't fall into that trap. You're just paving a way to bad skin health in the future, right? Go to a dermatologist, aesthetic physician, get help if you really need it. If you don't need it, or just want to include retinol in your skincare, then follow me. I can help you out. Like, you know, I have a lot of video on my Instagram that actually talks about starting retinoids for different skin type, and all these stuff in the guide of my profile on Instagram. And you can DM me anytime, you know, I can help you out. I also take online consultations in case you're interested, because self-promotion is what I am doing right now, and I think it's okay. Anyway, if this was helpful, subscribe. I'll see you in my next video. Bye.